Hi, everyone. It's going to give you a quick update of what's going on provincially. As you know, the numbers have been going down steadily. We are now at 210 cases that we've added from the previous day provincially. Again, driven by the GTA area, which is low as well. Ottawa had 10. I'm not going to bother showing the statistics, but we had we added one case over the weekend, where I think we've got 4 active cases. We have no hospitalizations and no active outbreaks in any of our congregate care settings, which is very good. Moving forward, as you know, we're going to go into step 2 as of Wednesday, June 30th, and that will entail a bit more people that can gather, 25 people gathering outdoors, 5 people indoors. And also increase retail. Waterparks are going to open, amusement parks are going to open, and we're now going to be poised to observe the data, make sure that everything is status quo, and as we continue to vaccinate more people, we've already reached obviously that threshold of 25% of second dose, which is step 3, and 75 to 80% of first dose, which in Ontario we've reached them for the most part. But I want people to know that we're also looking at other things. We're looking at Delta variants. We're looking at regional levels. We're looking at positivities and so on. It's not just the vaccination rates, but things are going in the right direction for both of those things. Speaking of numbers, I just wanted to say again, we've had some corrections. So there was a couple of 7 removed or 6 removed over the weekend. And again, same as data cleansing that was done last week as well, that removed a significant, a fair number of cases in our area. Unfortunately, we've had 2 fatalities that we've had over the last week. Elderly individuals who succumbed to COVID-19. We're looking at vaccination status. I don't have that right now, but we will be looking at that. It's tragic, but I can tell you that I was looking at the deaths overall in our area, and since we started vaccinating, they've really got down. You can see there was a peak and really gone down, and that's what we're seeing across the province. And so that is very, although it's very sad, we lost 2 more people, but obviously the rates of death have decreased in true association with the vaccine uptake, which is excellent. So that is very good for us in terms of our numbers and what we're seeing. Again, the fatalities and hospitalizations and so on are going down, and so that's what we need to be doing. I want to talk a bit about vaccinations. Vaccinations have been going well. At this point, we are now going to be, we had a bit of a decrease in our Pfizer deliveries this past week. Those will be made up, and we will get our allotment of July, but more towards the end of July. But we're also getting as much as Moderna as we need at this point in time. So we've now reached a level where we've vaccinated almost 180,000 individuals, and 137,000 individuals in our area, or close to 78%, have received 1 dose, and 45,000, or about 27%, have received a second dose. Now, those numbers are going to, particularly the second dose ones, are going to increase substantially as we've added the clinics. We've now going to this morning, as you know, the eligibility went to everybody 18 and over who can get their vaccine earlier for second dose. So we added this morning 7,143 new clinics booked for the week of July 11th, and a substantial number have already been booked, but please keep going. We're also going to be, at this point, adding 22,000 more positions as well in terms of clinics the week of July 18th and 25, and they'll be available. We're going to put them in at the end of the week, and they'll be available as of early next week. So there will be plenty of those as well. We'd really like to get those second doses going as much as we can. Of course, we're going to add more clinics. The reason we're hesitating is we just want to get a sight line on where our Pfizer delivery will start to increase again. And so that's what we're doing moving forward. Just of interest again, when we're looking at our second dose coverage, it's in the high 70% of people over 80, and then it goes downward. So, however, what we're seeing now is increased pickup of second doses. Some other hotspots which started second doses earlier and particularly among younger people are a bit higher than us in terms of second dose, but we're up there. We're going up there now. Like I said, 27% second dose, and that number is going to increase, I think, dramatically as we now rev up our clinics and now almost exclusively provide second dose. We're also doing vaccines in vulnerable areas, working with social services in Prescott Russell and in SDG in Cornwall to be able to identify vulnerable populations and go to them and ensure that we do not miss them as well. This is going on across the province, so we want to make sure that we optimally are going to the vulnerable situations who have barriers coming to our clinics. That includes pop-up clinics, that includes clinics at Agape Center and other similar centers. One of the things I just wanted to share with everybody is that there have been groups of people that have had booked their second appointment, that had their first appointment at the Cornwall Square in Cornwall, and they were their second appointment was given to them July 13th to 30th. Now, at that point in time, they were given an appointment at the Cornwall Square. However, since then we moved to the Benson Center. So individuals who have the appointment on days that we have our Benson Center appointment is no problem. They're just going to go to the Benson Center instead of that. And on the date of your appointment, which you have, it's not going to change. So I want to repeat. So individuals who have an appointment on dates that we have the Benson Center, then and that's available. That'll be available online for us. It'll be that they could just go to the Benson Center instead. Now, the individuals that have an appointment that doesn't coincide with the Benson Center date, they will be called individually and given another appointment for the Benson Centers. That's quite important. Again, each of the individuals have received an email and are being called to let them know. So I just wanted to share that. Donc, bonjour tout le monde. Je vais commencer avec les chiffres antérieurs. Je ne pense pas qu'il s'agit de vous montrer beaucoup des chiffres de notre région parce que ça va bien dans notre région. Ça va bien aussi au travers d'Ontario. On a augmenté de 210 cas depuis le jour précédent en Ontario. Toronto, Peel, encore, la plupart des cas sont là. Ottawa avait 10. Nous, on a ajouté, je pense, un cas cette fin de semaine et ça continue 0 à 1 aux quelques jours. Donc, nos taux d'infection sont très bas. Ça, c'est de bonnes nouvelles pour nous. Il faut dire aussi qu'il y avait des changements au niveau de rajout. On a augmenté quelques cas à cause du nettoyage du data du ministère. Mais ça reste que nous, au niveau de nos statistiques, on a 0 à 1 par quelques jours. Donc, ça va bien dans ce sens-là. Nous avons malheureusement ajouté deux fatalités dans notre région. Il s'agissait des personnes âgées qui sont morts du complications de COVID. Ça, c'est malheureux, c'est tragique, mais je peux voir aussi que le taux de décès a diminué de façon importante depuis que nous avons institué le vaccin. On ne sait pas l'état de vaccination de ces deux dernières fatalités, mais on va le vérifier. Aussi, je veux aussi souligner qu'on va avoir des nouveaux, comme je vous dis, on rentre dans l'étape 2 mercredi qui vient avec une augmentation de personnes qui pourront se rassembler à l'extérieur à 25 personnes et 5 dans l'intérieur. Il faut dire aussi que on va avoir des guidances. Le Canada avait des guidances pour les personnes qui étaient vaccinées 2 fois. Qu'est-ce qu'on peut faire, qu'est-ce qu'on ne peut pas faire avec des masques. Et Ontario va suivre très bientôt. En effet, nous allons rester quand même avec, à la fin, dépendamment de quelle étape qu'on a, il s'agissait que si on a avec des personnes qui sont tout vaccinés. On n'a pas besoin des masques, pas besoin de distance physique, sauf des circonstances. Si on n'est pas vacciné, en effet, on a besoin de porter des masques. Si on a des problèmes avec nos santé, immunocomprimés, etc., on devrait porter les masques aussi. Ou aussi, on prend soin des personnes qui sont vulnérables, etc. Et aussi, jusqu'à un certain point, si on est dans un milieu intérieur avec beaucoup de personnes, les foules, etc., on doit peut-être recommander les masques aussi. Mais ceci va venir au niveau d'Ontario. Donc, on va parler des vaccins, qui est de bonnes nouvelles aussi. Dans notre région, nous avons administré plus que 180 000 vaccins. Au niveau de première dose, on a 77 % de la population avec, c'est égal 137 000 personnes, et 45 000 personnes ont reçu la deuxième dose, donc ceci est à peu près 27 % de notre population. Et je peux vous dire que la plupart de la deuxième dose, c'est les personnes âgées, 80 et plus, mais on voit que avec l'âge, ça diminue, mais on est en train de rajouter des cliniques, et donc d'ici fin juillet, on va avoir faire beaucoup de progrès au niveau de taux de vaccination en deuxième dose. Aussi, nous avons ajouté plus que 7 000 positions places à réserver, si vous voulez, pour la semaine du 11 juillet. Et nous allons ajouter une autre 22 000 pour les semaines de juillet, le 18 et 25 juillet, avec 22 cliniques d'ajouter. Donc, les personnes qui ne peuvent pas trouver un rendez-vous, inquiétez-vous pas, il va y avoir des rendez-vous pour vous aussi. Aussi, au niveau des personnes qui pourront prendre rendez-vous pour leur deuxième dose est avancé. Dès aujourd'hui, on pourrait le faire, des personnes de 18 ans et plus. Donc, ça, c'est une autre chose. Donc, j'ai hâte qu'on commence à augmenter le débit de deuxième dose, qu'on voit nettement dans nos statistiques quotidiennes. Et aussi, ça, c'est de bonnes nouvelles pour nous, parce que là, pour l'étape 3, on a besoin d'être à 25 % deuxième dose, et 75 à 80 % population. Donc, on est là déjà, vacciné, première dose, mais on suit des autres choses aussi, 2-3 semaines entre les étapes. Les étapes 2 vont commencer le 2 mercredi, et 3 semaines après, à peu près, ça va commencer la troisième étape. Donc, c'est important d'avoir le taux de vaccination ciblé, mais aussi c'est important de voir des autres choses, hospitalisation, etc., des autres indicateurs pour ça. J'aimerais ajouter aussi que nous avons un groupe des personnes qui étaient vaccinées à Cornwall en mois d'avril-mai, qui étaient vaccinées avant qu'on ait eu nos centres d'immunisation au Benson Center. Étaient vaccinés au centre Cornwall, au centre d'achat Cornwall, et ils ont eu le rendez-vous pour le mois de juillet. Plus spécifiquement, il y avait le groupe qui, c'était les dates de le 13 à 30 juillet. Ces personnes ont eu leur rendez-vous qui est écrit à Cornwall Square, au centre d'achat de Cornwall. Mais les cliniques vont prendre lieu au Benson Center. Si ça tombe que les personnes ont eu le premier groupe qui ont eu le rendez-vous avec la même journée qu'on a des cliniques à Benson Center, il n'y a pas de problème. Ils vont juste aller au Benson Center au lieu d'aller au Cornwall Square. Mais les personnes sur l'autre groupe qui ont les cliniques initialement bookées pour Cornwall Square, pour les dates où on n'a pas de clinique à Benson Center, qui ne coïncident pas, ils vont être appelés pour reprendre le rendez-vous et une nouvelle date pour le Benson Center. Donc ça, c'est très important. So that's it. I'm going to go to the phones, but before I do that, I forgot to say in English that one of the things that people are asking us about are masking guidelines and public health precautions for doubly vaccinated individuals, for fully vaccinated individuals. As you know, Canada released their recommendations, and I know that Ontario will follow suit very shortly. I can tell you that at the end of the day, we're going to end up in a progressive way of people people who are fully vaccinated, in a home or in an indoor setting, do not have to wear masks, even if they're from other households. No physical distancing, and we'll get to a place eventually where masking will be only reserved for certain situations. For example, if you're not vaccinated, obviously, if you are vaccinated but are immunocompromised, or if you are taking care of immunocompromised individuals, or at some point where there's large indoor crowds where perhaps the masking would be helpful, and so on. So those things are going to eventually come into play, and eventually there will, obviously when we get a high enough herd immunity, there will not be any of the those restrictions or public health measures required, because we'll have herd immunity and everybody will be protected either directly or indirectly. So Jenna, we'll go to the media for questions. I've actually answered. I only had 3 questions from the media before, and I've actually addressed those.
Thank you, Dr. Paul. Merci. Philip Blanchard, Morrisburg Leader. Please go ahead.
Good afternoon, Dr. Paul.
Hi, Philip.
So first question right off the bat. Third clinic in Morrisburg is now open. That was last Thursday. Are there any more being scheduled for Morrisburg or in South Dundas in the future?
Yes, they are. I don't know. I can't tell you exactly when they are, but they should be. I don't have them right now. We have one in Embrun, and there will be some in Morrisburg at some point. I can't tell you exactly, but that's what we're planning. Yes.
Okay. Second question. Youth 12 to 17 do not need an appointment to get a dose of Pfizer and can just walk in. Is that only for first doses? What about the ones that have already received their first dose and need a second? Should they reschedule or can they walk in?
No, we're targeting first of all, targeting 12 to 17s from our area, that because we have a low uptake. We're only about a 52% of those individuals. We'd like to be at the 70-75% range. So we want to make sure there are no barriers. That's why we're doing that. So we're preferring first dose. Eventually, when their time comes, they can get their second doses, walk in as well. But right now we want to get a good first dose coverage, at least in the 70-75% range, if not more. But provincially, we're running behind. We're around, like I said, in our area, 52%, 53%.
Okay, and is that also for the age groups older, like in the 20 to the millennial generation, like the 20 to 29 and the 30 to 39?
At this point, no. We're just looking specifically at the 12 to 17-year-olds. Yes, and we do want to increase uptake in those age groups as well, because as you go down the age spectrum, the percentage of first dose decreases. But right now is specific for school age kids. We want to get them. We want to ensure we get the first dose in time so we can get them the second dose before school starts.
Okay. And last question. It's hot outside. That's stating the obvious there. Some areas outside of Ontario are prioritizing heat relief over COVID spacing restrictions. Normally, the UHU operates some cooling centers, and there's usually things like malls and so on as well. Are you looking at prioritizing heat relief over COVID spacing as well before we hit the reopening?
We'd like to balance the two, like we did last year. We actually had guidelines for having safe cooling centers and so on. So I think we can do both. They're not mutually exclusive.
Okay, thank you.
You're welcome.
Prochaine question, Denis Babin, Radio-Canada, c'est à vous.
Bonjour, Dr. Paul.
Bonjour, Denis.
Écoutez, pour faire suite à la question qui a été posée par Philippe, idéalement, à la rentrée scolaire, quel serait le taux de vaccination des 12 à 17 ans de cette tranche d'âge-là avec les 2 doses?
Qu'est-ce qu'on souhaite avoir? Nos buts?
Oui.
Au moins 80%. 75 à 80%. Normalement, on dit 70 à 75%, mais à cause qu'on a des nouveaux données au niveau de Delta, ça prend un peu plus de protection.
Parfait, merci beaucoup.
Pas de problème.
Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you. Merci tout le monde.